Hello, everyone. Today is Saturday, August 15th, and this is your host, Mr. Straight Talk. As of today, the United States have recorded over 5 million coronavirus cases, with reported close to 170,000 deaths. As the world moves forward from a shutdown phase, which was placed early in the pandemic, millions of people worldwide are still facing worsening health conditions, well, as they try to postpone the non-urgent treatments that they were told to do that during the pandemic. Whether it's mental health or dental health, ignoring any small problem early in its development can lead to massive problems, which can be devastating not only to the health, but also to the economy of the world. Well, today we have a panel of four dental health professionals as our guests, and they can discuss how they are striving hard to deliver dental health services to their patients during a pandemic and help their patients to protect and preserve their dental health. We'll talk about the safety of delivery of dental care during the pandemic, and we hope the public can make proper informed decision about their health after listening to this episode. Well, there's a lot of conflicting information out there on the internet. We all know about that. And it's about time we take the questions to the experts. We can help to dissect what's the right information and what's the wrong information. With that, I would like to open the panel. Welcome everybody. Welcome doctors to the show. How's everybody doing?
Doing great.
Great.
Doing well. Thanks for having us here today, Mr. Straight Talk.
Thank you. I'll have each of you all introduce yourself to the listeners. So please tell our listeners where you practice, what is the scope of your practice, and how many years you've been doing, the wonderful service of providing and protecting dental health of your patients.
My name is Dr. Amy Nguyen from Smilecraft Dental. I proudly serve the Bay Area in offices in Mountain View and Redwood City, California. And I've been out for 10 years, and I'm a general dentist. So we do everything from checkup and cleanings. We have orthodontic treatment, crowns, bridges, bondings, veneers, pretty much anything you can think of.
Great. And
I'm Dr. Lee Panec. I'm from Mountain View, California. I both live and practice here. I've been practicing for 38 years and seen a lot of changes in dentistry and gone through a lot of these health issues that we've had to deal with. But we're pretty much a general dental practice and take care of all your needs through either our office or referrals.
fantastic, Dr. Panec.
I'm Dr. Greg Armi, and I also practice in Mountain View. I've been practicing for 36 years. I practiced with my dad for a number of years until he retired, and again, a general practice.
Great. And Dr. Sawyer?
Yep, my name is Dr. Kevin Sawyer. I'm a general dentist practicing in Los Altos. I've been practicing dentistry for 37 years. And like most of my cohorts here, we treat children and adults in just about all aspects of dental treatment and prevention.
Perfect. Fantastic. So, doctors, we just want to put a disclaimer out there for all the listeners that none of you all are interconnected in terms of from business standpoint or financially. So this is going to be a fair podcast episode. So it's not something which is business oriented. This is going to be pure explanation of what's right and what's wrong for the patients. Can we all agree on that?
Absolutely.
Yes, that's correct.
Okay, perfect. So with that, let's just talk about dentistry in general, and let's talk about how this pandemic, which is based on this novel coronavirus, which was new to the world and new to public as me, and and then of course affecting you as a dental provider. But how has that changed your practice? How did you first receive COVID-19 as a pandemic into your practice, where you were forced to shut down? and how did you handle that, and how did you manage and move on from that? So I'll
Well,
open this question to you all, and when you answer, just tell your name, and then maybe others can pitch in as well.
yeah, this is Dr. Amy Nguyen again. I just wanted to just clarify something that you just said. We were never forced to shut down. That was a conscious decision that we made. As dental healthcare providers, we're considered essential workers, and we're there to provide, dental care that can save lives to people. And the decision to shut down was not one that we did lightly. We did that, um, for the safety of our patients, just because when everything was happening, we had no idea what this virus was capable of, how it was spread, how it was coming in. So in shutting down, we did that to keep everybody safe until we were able to learn more about it. And as the CDC and the WHO offered more information about this virus, that was when we were finally able to figure out plans on how to reopen safely again. So it wasn't a matter of being forced in any way. It was just I'm sure others might feel the same way, but I did it just so I could keep myself safe, my team safe, and my patients safe until we really, really figured out what the mode of transmission was and how to counter that.
Yeah,
Wonderful,
I agree.
wonderful.
I think that it was the CDC in cooperation with the American Dental Association and the California Dental Association on the 16th of March that recommended that we treat only emergency, urgent dental issues. And so we never actually completely shut down. I know that first week or two, in my case, we did a lot of teledentistry, wrote a lot of prescriptions for antibiotics because nobody really knew what we needed to do as far as going back into the office. But, dentistry isn't something that you can postpone for very long. And after a couple of weeks, I started having patients calling with problems that couldn't be postponed any longer. And I don't know, 4, 5, 6 times a week, I would have to go into the office and at least temporarily repair either a broken tooth or an infection or a cavity that went into the nerve. And so we were working, but on a much slower basis.
Well, I
And
think
that's
this is Dr. Greg Armi. I have kind of a little bit of a different take on it. I felt, at first we weren't forced to close down, but the county all of a sudden decided that we were no longer essential, and that we had to close down at that point. And it wasn't until later on that they declared us essential healthcare workers that we could open back up again. To me, it just shows how little they knew what to do and how to do it, and kind of left us in limbo as far as what to do. But that being said, I think dentistry has had to deal with so many things over the years in our practice settings. The latest one probably being the AIDS epidemic that came about, that changed many things about how we did things. We are such a safe environment, more so than I think any other healthcare environment, that we know how to clean surfaces and keep areas sterile and clean and be able to practice the way we do. And that has helped us more than anything to maintain our practices now. And certainly with the WHO and the CDC not really knowing how transmission is being done, we probably have gone overkill on trying to make our patients safe and our staff safe when treating patients. But it seems to be working.
Well, what I find, this is Dr. Lee Panec, what I find interesting in this whole design, and I agree with everybody, and I'm not going to repeat everything that I'm doing, but and I'll go into that later. But what I found historically, having been, I came out of school in 1982, and when I came out of school, the only time we wore gloves and a mask was when we were doing surgeries in periodontal work or oral surgery. And that changed immediately when I came out of school and did my general practice residency. But the interesting thing is we have been probably been exposed to this virus since November, at least December, if in January and February and March, and there have been no documented cases of transmission in the dental office. And that being said, that tells me that the precautions we have been taking and the cleanliness that we have been performing in our offices, the sterilization procedures, are somewhat adequate to take care of this. Now, we have ramped up quite a bit. And I don't know how much Dr. Traytalk wants to go into this, but like a patient comes to our office, before they get there, and I know almost everyone else does this. I'm familiar with Dr. Armi because he's a friend and he and I have discussed this. So a patient comes to the office, they're screened verbally, their temperature's taken. Before they get there, they're screened on the phone. They're screened when they get the office, temperature taken, oral rinses with some sort of, we use hydrogen peroxide, which seems to work, but there are other modalities. You know, you don't move around my office without a mask on. If you come to deliver something, you get your temperature taken. I mean, nobody is in or out of that office without a mask on. And so that level, we have air purifiers in every room that basically turn the air over in our office about every 4 minutes. So, I mean, the airflow for vapors, I mean, it depends on where you want to go as far as sterilization. But the challenge we have is this is an unknown. Just because you find virus particles doesn't mean they're infective. And that's the challenge we have, is we don't have enough information. So we are actually doing probably a lot more than we have to, and I'm okay with that. I would rather wear a belt and a suspenders than, no belt and no suspenders.
I think it's wonderful. I think just listening to all these points just makes me feel so protected. If the dentists in general are taking so much precautions to protect my health and everybody else's health, that it just feels wonderful. And it's wonderful. It's a wonderful sense of feeling that you guys all are doing. So can we go? I mean, I have all the time here, but can we? I mean, I would love to hear all these, and I'm sure the listeners would love to hear all these important points that Dr. Panec you just covered about this the questionnaire that you take temperatures, you ask certain questions. So is that across the board? Can we go a little bit more in detail on what how that's helping out in terms of delivery of safe dental care?
Well, I think this is Dr. Greg Armi. I think just doing those kinds of basic things helps us identify who could be a possible carrier, and therefore trying to eliminate those people out of the practice. That keeps any other patients who are there safe, it keeps the staff safe, and it makes everybody feel comfortable that we're doing everything we can. So if somebody, for example, has been flying from Seattle down to California and they flew in, just last week, and if they have been flying, we say, well, we really can't see you for at least 14 days of quarantine to make sure that you're not sick. And so we will not accept them in the practice. And that's just a simple precautionary method so that we're not getting people who are sick, treating them and possibly spreading the virus.
Got it.
I think that.
And is this something that you all developed on? Like, we all are learning about. Like, we are learning. I'm, as a common man, I'm learning after I read and listen to, professionals. But is this something that you developed in your own practice? These certain protocols just to improve the health and safety of your team and also of your patients? Is that what I'm hearing? Is that true for all four of you?
Yes, this is Dr. Kevin Sawyer. The guidelines that we're all operating under have been developed in conjunction with the CDC, the ADA, American Dental Association, California Dental Association. So we have a list of about 10 questions that ask if you have had a cough, if you're running a temperature, if you've lost your sense of taste or smell, if you have digestive problems, age problem, any other health problems, as Dr. Armi alluded to, have you been traveling? Those are a number of the screening questions that we ask before the patient even comes into the office. And then when they come into the office, we ask that again. In our case, we also ask them to sign a statement that if they become ill within the next 48 hours, that they will contact us. Obviously, we would do the same for them. All of our staff are tested, in our case, either every 2 or 4 weeks, depending on the staff members, just to make sure that we all test negative for COVID. I'd like to say one other thing. I have patients that come in and ask me, and friends that ask me, should I wear a mask? I mean, that's probably one of the biggest things that's going on right now.
True.
And I tell them, I said, do you know how many people have gotten COVID in a dental office? Do you know how many dental office personnel have gotten COVID from a patient? And they say, no, how many? I say, 0, absolutely 0. What do dentists do that the general public doesn't do? Well, we wash our hands incessantly. We must wash our hands over 100 times plus a day. We wear a mask. We're trained day one in dental school to not touch your hands to your face. And then we treat people that are healthy. As Dr. Armi alluded, if somebody has a possibility of not being healthy, if they have a cold, if they have a cough, if they're not feeling well, we tell them, why don't you get better and we'll see you in a couple weeks. So I think if the public adhered to that, if they wore a mask, wash their hands, don't touch their face, and stayed away from sick people, that this pandemic would be gone. Just act like a dentist.
I think it seems so simple way of fixing this bigger problem, right? Just listening to you all, and if common public puts a mask on and washes their hands, we can probably fight this illness together.
Well, I think this is Dr. Greg Armi again. When we first heard about this and trying to come up with protocols from the CDC and the ADA and the CDA, as well as public health, county public health, there were so many conflicting ideas that were out there and conflicting scenarios that it really became upon us as healthcare providers who understand disease, who understand the transmission of disease, especially in our offices and our practice settings, that we came up with these protocols based on what we know and the science that we know. And that's how we've kind of come up with all these different issues. Now, at the same time, the more we learn about the transmission of the disease helps us refine those things to make sure that it's not over cumbersome, it's not overkill, but it is actually what we call the best practices, which is going to give us the best results. Nothing is 100%. And that we've had so few or actually no cases documented coming out of a dental practice tells you that kind of science, that kind of thought process actually works really well. When we had the latest news come out on Cron and Channel 2 about the WHO saying stay away from dental offices, I was actually shocked when I read the article of what they actually said, that there was no science behind it. It was actually just opinion. It is their opinion that the aerosols would transmit diseases and the aerosols that we produce. Let alone Dr. Sawyer.
I agree with you that, Greg, let me interrupt for a second.
Sure.
That World Health Organization article almost mirrored what we all thought back in March, before we had any idea of what happened and how this disease worked. Interesting. You're right. They didn't quote the CDC or anybody else. Greg, sorry to interrupt. Go ahead.
No, and what I appreciated is my colleague Dr. Sawyer. He sent us an article from Lancet that did actually the science and said that the aerosols that we produce, because we use sterile water or purified water when we spray, that it actually dilutes the COVID-19 if it was there, which would make it a less pathogenic because there is not as many of these viruses there. So those aerosols that they were thinking about are not the aerosols that we produce. Now, do we still try to limit that? Yes, we do. Do we sterilize all the surfaces afterwards? Yes, we do. We purify the air, we wear shields, we protect our patients. So we're doing all the things that we've done before, and they work.
Exactly.
So, Dr. Lee Panec here. So this morning I actually was just on a Zoom meeting, and one of the people on the Zoom meeting with me is a physician, a Stanford researcher, and I won't embarrass him by using his name, but his points to me when I brought up the WHO question, the World Health Organization, and he, in all defense of the WHO, they're looking at the world, right?
Correct.
They don't have an idea of what we do in like our state or our area. So in their defense, yes, my problem and my issue was that some of these stations that just threw this out there did not contact the CDC, the American Dental Association, the California Dental Association, to get a caveat that they could have put on their program. Yes, this came out from the WHO, but so our president of our dental association went on, I think he was on Good Morning America, to try to explain where we are. And I find the best thing to do, at least in my office and what we're going to be doing when people call in, is instead of attacking the WHO, which there's a lot of fodder out there that you can go after, but is actually stating what everyone in this call states. And I know that the precautions that we all take, I've seen all these offices, and each one of us has a different environment that we have to deal with. And we had to use our training to make that environment safe. Some people have closed rooms so they can fog. Some people have open bay system and external windows that go into the parking lot, but people are out there, so you can't pump air out in there that's not filtered. So we have to, each office has its own challenges. And that's where the dedication of all these dental professionals that I know on this call have stepped up to take this on. And most of the dental professionals I know are really doing a great job. And I'm really impressed with our profession.
Just listening to you all, if I have to make like a small, conclusion on what I feel as a person, as an individual who needs access to dental care is, number one, dentists who are trained to constantly be in somebody's mouth are not fearful, number one, about this disease. Is that correct? That's if I say that, is that an accurate statement?
That's absolutely accurate, because if I didn't feel safe, I wouldn't feel good about, coming to work myself and then bringing it home to my family, or asking my fellow employees to risk their lives being there. If I didn't feel safe, none of us would be there, let alone the patients.
Correct. And that in general is because of all these excellent preparations that you all are doing in your offices, making sure, in terms of hand hygiene or protection that you guys take for masks, and making sure you ask all these appropriate questions to screen the patient. And also doing all these preparations, one of I think Dr. Armi was saying about mouthwash or some sort of rinse that you all let your patients. So that and also all you guys use the sterilized water to dilute the aerosols, and that all tells me that these precautions are enough for patients to be feeling safe, to not ignore and neglect the health that they need to protect their oral health? Is that an accurate way of
I would
coming
agree
to a
with that.
conclusion?
Yes, very
I
much
would agree
so.
with it.
Mr. Straight Talk, this is Dr. Sawyer. I'd like to also say that some of the little things that we do for our patients that have changed are that, number one, the second they walk in the door, we have them use a hand sanitizer. Either when they walk in the door, before we walk in the door, we go through the screening questions and we check their temperature. Our waiting rooms look different than they used to. No one talked about that yet. You know, our waiting rooms
Interesting.
only have
Nobody's
a
in
couple
them.
chairs in them. Yeah, well, it's true. We don't allow anybody to congregate in the waiting room. If it's your appointment, we'll signal when you can come into the office. There's no magazines any longer, no touch surfaces. Patients are wearing a mask from the minute they walk in the office until they sit down in the chair and are allowed to remove their mask. If they have to go to the bathroom, they should know that every time somebody comes out of that bathroom, we go back in and sterilize the bathroom. Not only just our operatories, but the bathroom. Doorknobs, the chairs, the handles on the chairs in our waiting room all get cleaned probably every 30 to 40 minutes. Anytime somebody comes in and touches something, we go back and untouch it. The pens that we have them click the little boxes on the screening question, those all get wiped, disinfected. We have a little bucket of sterile disinfected pens and then a discarded pen. Some offices have gone so far as to have pens made up and just give them as a sample. Here, keep it. This is your pen. So we're doing everything we can and more to make our patients feel safe and comfortable when they come into our office.
It almost feels like the dental office is much safer than somebody's car or home, the way you guys are doing and keeping it nice and clean.
It's definitely safer than the grocery store.
Oh, yeah.
True. We all read about oral health is also connected to overall health and the general health. So when patients were not seeing you all for elective procedures, and when they started to see you overall, how many months were you all postponing all the elective care? Is it fair to say maybe 2-3 months during that early pandemic phase? If I kind of judge that, is 2-3 months kind of a ballpark that you guys all were closed for elective cares and only emergencies?
Yes,
Yeah,
I
2
would
months
say
is
that was
accurate for
true.
me.
So
Yeah,
when you guys started to see patients back, were patients, were they going through a lot of mental health changes, or how emotional were they? These patients are like your family. You've been seeing them for years. Did you see a drastic change in how patients were? Was there any emotional changes within the patients itself? You know what I'm getting to, because of this disease that we
Well,
all are going through.
Go ahead.
In my case, most of the patients early on that we saw had gratitude. They were just so thankful that we were there to take care of them, and they had issues, and we have some of those patients who are a little timid, and obviously this WHO thing didn't help, but they're a little timid. But we do what we do right here, is we try to explain to them what we're doing in the office to protect them. That's the best you can do, and then leave the decision to them. But there is still some fear out there.
Yeah, my opinion is that all the patients are different. Some are very thankful to come back in. They were just waiting for us to reopen. Others were a little bit more concerned about things. They asked a lot more questions that we could answer so that they could feel safe. And some patients just don't feel safe no matter what we do. So they're staying away unless they're having severe problems. What happens, though, is that the patients end up waiting too long, and then something drastic happens, and something that could have been taken care of very easily and inexpensively becomes something more expensive, like needing a root canal and a buildup, or having a tooth crack in two, and now it ends up going to be extracted, and they're going to need an implant. So these things, when they get postponed, they don't get better, they get worse. And if they're going to get worse, they're always going to be more expensive. So,
And not only that, Dr. Armi, but it's important to know that, having regular dental checkup and cleanings, it helps us to detect and manage dental issues at an early stage, not only just tooth-related problems, but things that can affect the overall systemic health as well. Gum disease has been correlated to diabetes and heart disease, and all these things do make people at higher risk for getting COVID. So it's important to make sure your oral health is really good in order to keep your immune system healthier.
yeah, I think
Very true.
the difference between dentistry when I first was going to school in the 80s to dentistry now is the connection with our overall health. That your oral health is directly connected to your overall health in the body, and much more so than we ever thought, 20 years ago. In fact, one of the latest dental health issues was from a patient of mine who was doing research and wrote the paper on Alzheimer's. And it turns out that there is a direct relationship between periodontal disease, gum disease, and Alzheimer's. And that just came out within the last year. We already knew about the heart disease and stroke and diabetes, but Alzheimer's. Now you start putting all these things together and you say, I really better start taking care of myself and taking care of my teeth, because that's going to affect me my entire life.
Mm-hmm.
Correct.
It's well established, Dr. Sawyer here. It's well established that what's going on in the mouth affects the rest of the body. And especially, as Amy was saying, with older adults who may have some medical conditions like chronic lung disease, diabetes, heart conditions, chronic kidney disease, that they are at a higher risk of having a more serious case of SARS-CoV infection. And so by keeping good oral health, then they're not going to have that next step. There's some studies that have talked about the pathogens basically coming from the mouth, your own pathogens coming from the mouth, and they can adhere to the lung epithelium. And so keeping your mouth healthy will give you a certainly better chance at fighting any exposure that you end up having with COVID.
Fantastic. I think it's much more clear that simple things like our body is so interconnected, right? So even oral health, even though people might think that it's something so not that important, but it ends up being truly important when it's directly related to diabetes and heart condition. And then we all know how this disease affects patients with multiple medical conditions, especially diabetes and high blood pressure and heart conditions. So, doctors, this is really great. I mean, all this information that you guys are giving on, passing on with so much experience you all have combined, with many years. I think it's really an eye opener and really clears all the fog and all the haziness picture around this illness and around how people should take care of their health. What information do you all have around the testing of COVID and around the vaccines? Is there anything that you guys know about that the common people should know too?
Well, I'm not sure a vaccine is going to come soon enough. And from what I've read, and this comes from Italy, that so much of the virus now has mutated into a less virulent form, so it's not seeming to have the same seriousness of health issues. It could be by the time we get a vaccine that this is just going to turn into a flu rather than a deadly flu.
Mm-hmm.
But we don't know. We really don't know how this is going to transpire, and all we can do is go on history. And history kind of shows us that these things kind of come and eventually they disappear.
Mm-hmm.
So
if somebody
we'll have
is
to wait and see.
so if somebody is sitting on the fence of waiting for that vaccine to start taking care of their own health, I think that's probably not a good choice. That's what I'm thinking. If we're waiting for a vaccine to come to start taking care of their own health condition, I think probably not a good choice. Is that true?
I think that's absolutely true. And it's not only true in dentistry, but it's true of all of medicine. What we all have experienced with our slowdown as far as treating patients has happened equally in the medical field. And Mr. Straight Talk, I'd love to hear you talk to some surgeons and some physicians that I think
Mm-hmm.
we're finding that so many people have postponed their regular routine scheduled medical treatments, surgeries, even going in for the fact they're not feeling well. We're seeing more heart attacks. I think that we need to, find a way to be able to let everybody know that, with proper guidelines, that it's safe to go to not just the dental office, but the medical office as well.
And one other thing is a lot of the testing that's being done, for the most part, it's pretty good. But there's been a lot of false positives. And just from some of the articles that I've read, if you've gotten a false positive and then it turns into a negative and it gets tested a third time and says, oh, yes, it was negative, the ramifications for those individuals is horrendous. So some of this testing is almost as damaging as getting the virus itself.
Mm-hmm.
And which creates a very big problem for doctors' offices, for patients. Not that they shouldn't get tested, but these false positives, they're a real danger.
There have been also conflicting messages that are coming that actually did come from, uh, I think, the World Health Organization or some other organization, which was on an international level, where they initially claimed that the virus probably wasn't that infective from human to human transmissions, and then they retracted that statement. So I believe I hear what you're saying. I think this is such a new virus that everybody else is trying to get their arms around it to try to find for the right, not even just the recommendation, but also testing. I mean, all these testings. I really commend what the researchers are doing, but I think they're trying to push something which could take many years into days of results. So that's the limitation. What they probably are facing is on their end as well, because they want to ramp up the production to make sure it's done to take care of for public safety, but they end up maybe they didn't unknowingly end up being short of what the right thing would be.
Well, if we think about the vaccine in the 1911 to 1919 or 1919, I think is when the Spanish flu ravaged the world as the pandemic. Well, we didn't have vaccines back then.
Mm-hmm.
So something had to change, that it no longer became this virulent strain that was killing everybody. And viruses do have a tendency to mutate so quickly that they eventually become less and less of a problem. So chances of us getting a vaccine in time to make everybody feel safe and to get on with their lives is probably not going to happen. So we need to take the precautions that we know work, and that is wash your hands, don't touch your face, wear a mask right now, because that mask is not actually protecting you as much is this protecting those people that you love in case you do have it.
Mm-hmm.
Right.
Yeah, I agree with you, Dr. Armi. As far as testing, unless you're able to get a test back within a reasonable period of time, it's somewhat useless. To say that you didn't test positive last week doesn't do very much good for anybody. We need to know within 24 hours so that we can, trace our contacts so we can tell those people that they need to isolate. And if you have somebody in a work environment, it doesn't matter whether they work in a dental office or a grocery store or anywhere else. If they're having some symptoms, and so then they decide to self quarantine, or their physician tells them to quarantine, and they take a test and they don't get a result back for a week. That's somebody that's unemployed for a week. It's a business that doesn't have an employee. We need to have if we're going to do the testing, we need to have the answers pretty much right away. Uh, the other thing I wanted to touch on a little bit, we haven't talked about viral load.
Mm-hmm.
Some of the researchers are talking about, and I think that's what may have happened in Italy now too. Now that we're wearing masks, both for our protection and for our friends' protection, the amount of virus that we're spreading from face to face is very minimal. And it seems in the research that I've read is that the severity of the infection is has a correlation, very strong correlation with how much virus you got. If you're sitting across the table from somebody 8 hours a day, every day, and they are sick, you're going to get quite a bit of virus from them. If you walk past somebody casually outside, if they're wearing a mask and you're wearing a mask, even if they're sick, you're not going to get any transmission of the virus. You need enough of a viral load to be able to get sick. And the minimal amount of viral load, actually, some people are saying is could be a good thing because you can build some immunity. And some of the physicians that I read said that that may be where we're getting these people that are asymptomatic, that they got exposed to the virus, but such a minimal amount that their body was able to recognize it, form the antibodies, and they never got sick.
So
Right. I just read.
two things touched on that I wanted to comment on. One is it's really nice to see people wearing masks, but if you see somebody with a mask with a valve in it, that's not doing you any good because
Okay, that's interesting.
it's designed for dust. So when they breathe out, everything's coming out that valve. So if like in my office, I have masks with valves on it, but I wear a mask over it, so it takes
Mm-hmm.
care of that. That's the
Mm-hmm.
first thing. The second thing you talked about was the vaccine. Now, supposedly the Russians have come up with one. What's disturbing is they don't really have good trials, and they're starting to do human testing, I believe, which is kind of
Mm-hmm.
scary. I think they're pushing the envelope, but maybe they can get away with that. But I think we really have to tread softly on this. And every vaccine has a different target. The one I believe they have is targeting they have a protein that's targeting the little attachment on the outside of the virus. You know, it looks like a ball with spikes, and it's gumming up the
Mm-hmm.
spikes. So
Mm-hmm.
if that works, that should be great, except the virus isn't dead. So I don't know
True.
what that's going to mean, but these are all questions that hopefully in the next 2-3 months we get answers for.
I was listening to, and you made an important point, Dr. Panec, about this Russian vaccine, because I was listening to the World Health Organization briefing that took place, I think, a couple of days ago. And they mentioned somebody asked about this Russian vaccine in that meeting as well. And one of the reporters asked that question, and they were the WHO. They mentioned that they have a program in place called COVAX, where all the countries they compile their research and they do a collaborative efforts to develop this vaccine in and accelerate that program, that the time is shrunk so that doesn't take many years. But apparently this particular vaccine is not part of that. So even the World Health Organization doesn't really have a clue of what this vaccine is based on. So that's an important point that you brought up, that we don't know whether this vaccine is real or not real. So and what I feel is just listening to you all, you've all have done things which will really drive down the influenza pandemic also. I mean, with somebody washing hands, putting a mask on. So is that something that you expect as well, that all these measures will also improve uh, uh, to drive down the numbers of influenza in the society as well?
Well, I think after this, our society will change, at least for the next 20 years, before society becomes has forgotten about everything that's happened. You know, our memories are fairly short and we go back to our normal lives again. But for at least the next probably 10 years, I think our society will change. And during those flu seasons, you're going to see more people wear masks and more people be more wary about their surroundings.
True. We covered a lot of points, doctors, and I think you all and all the dental health professionals all around the world are truly heroes to go in and work in somebody's mouth and get direct in the line of fire from the virus, which it's coming out from other people's mouth and nose and all those places. So I think you truly have my respect. All the dental professionals have respect, and you guys carry on the good work and continue the fight against the virus and continue providing great care. Any other
Well,
questions or any other points that you all would like to uh, tell the listeners?
no, I think I just want to thank you very much for having us on here so that we can at least reach out to our community and let them know we are doing everything we can to keep them safe. And thank you for giving us a platform to do that.
Yes,
You
thank
all are
you.
very welcome. Well, thank you, Dr. Nguyen. Thank you, Dr. Sawyer. Thank you, Dr. Panec. Thank you, Dr. Armi. And thank you to all you great dental health professionals out there. Keep doing what you are. And just listening to you all just makes me and everybody else who will listen to this podcast once I publish it, that going to a dental office is safe and people should not ignore their dental health because that can lead to much bigger problems down the line. And dental health is definitely connected to overall health. So we want to protect our health. We want to protect uh, our heart and our diabetes conditions and high blood pressure issues, so we don't get those higher symptoms that we can get from this virus. Because we all know in a perfectly healthy patient, this virus doesn't do much damage than somebody who's really sick. So I truly appreciate you all. I wish you all, be safe, be healthy, and have a wonderful week. And I appreciate your time, take from your family and from your friends, that you all chose to take your time off for this weekend. So thank you all.
Thank you.
Thank you.
It's been a pleasure. Thank you so much, and I hope I get to meet you all in person one day.
Thank you. Thank you. We will. Bye bye. Have a good weekend.
Bye.
Bye-bye.
Bye.
All right, everybody. This was, again, a wonderful session with all four dental health experts in California. And, this makes it even much more easier for people to not have that fear of accessing their dentist. Talk to your dentist. If you're worried about something that you read in the media or some article that you're not comfortable or you have suspicion about, I think these are truly great professionals that uh, giving them a call, calling them and asking for what they feel about this or particular issue that could have come up would clear any sort of misunderstandings around your health. So protect your health, be safe, be healthy. You listen to them, wear a mask, wash your hands, don't touch your face, and protect your loved ones by wearing a mask. And that's what you truly are doing to stop and slow the spread. So, again, have a wonderful weekend, everybody. And until next time, ciao.